hope on the horizon. China is now lifting the lockdown across most of the area hardest hit by coronavirus. People who are cleared will be able to leave the Hubei province, where transportation services have started up again. That province has seen almost no new locally acquired infections in more than a week now. The city of Wuhan, the epicenter of the outbreak, will remain locked down through April 8th.
And then there's a promising sign coming out of Asia this morning. South Korea, which saw its first confirmed coronavirus case on the same day as the United States, now appears to be flattening the curve after an initial spike. ABC's TJ Holmes shows us how health experts say South Korea properly stopped the spread.
As coronavirus spreads across the West, new signs of hope in Asia, and in particular South Korea, where there's been a dramatic turnaround. The number of infections skyrocketed there from dozens to thousands in early March. But now they're reporting the lowest number of new cases, just 64 in a single day, since their peak weeks ago. And they didn't lock down entire cities. Experts say swift action from the very beginning was key. That included social distancing, contact tracing, widespread testing, and they were prepared.
They made sure they had enough ventilators, they had enough personal protective equipment, made sure masks were being produced and mass produced. So all those things, that's the full set of epidemic strategies they implemented very quickly.
Both South Korea and the U.S. reported their first case of COVID-19 on the same day, January 20th. But South Korea then did something the U.S. has not, implemented a system to electronically track people and the disease.
South Korea used different types of tracking measures to figure out where people were moving, whether they were violating social distancing measures. So, for instance, if they are supposed to be staying at home and instead they're out on the street or using public transportation, they were able to figure that out fairly quickly.
Here's an example of how it works. Let's say you find out you have coronavirus. The government then uses your cell phone and credit card data to track where you've been and then blast out an alert to the cell phones of people who may have crossed your path. Our own Jui Cho showing us what one of those alerts looks like on her phone. Another major difference. Here in the U.S., the N95 mask supply is limited, and the CDC advises people not to wear face masks unless they're sick or caring for someone who's ill. But in South Korea, masks are widespread and encouraged by the government. Monique Claiborne, who is from the U.S. but has lived in South Korea for 3 years, says she doesn't leave home without one.
Masks are actually quite easy to get here from any of the convenience stores or any of the drugstores because people tend to wear them due to the air pollution occasionally anyways. So everyone's wearing masks. People have been very, very vigilant with that.
That was TJ Holmes reporting. Health experts also praised South Korea's approach to testing. Doctors there tested everyone to find out where exactly the virus hotspots were and who was infected. In the U.S., health experts say we are far behind in the testing approach, meaning there are likely far more people with COVID-19.
Coming up next, re-examining restrictions, the timeline from the White House to ease safety limits put in place to help stop the spread of coronavirus, and when the Senate could reach a deal helping millions of Americans. That's next.